Hello everyone.
Hello guys.
What's our today's program?
Today we shall discuss the August 2012.
Okay, then can anyone read the essay question?
Knee joint is the first essay question.
Guys, we have already discussed this question in previous year question paper.
Oops, then what is the next essay?
Radial nerve is the second essay question.
Oh, guys, we discussed this question too in previous year question paper.
Then, shall we move on to 5-mark question?
Sure, can anyone read the 5-mark question?
Before that, we shall read all repeated question of this question paper.
Okay, it's a good idea. Can anyone read the repeated question?
Lower end of humerus. Foot drop. Supination and pronation. Gluteus maximus muscle. Circle of Willis. Cubital fossa. These 5 marks are a repeated question of this question paper.
Balance, we are having 2 5-mark question to discuss.
Can anyone read the question?
Atlantoaxial joint.
The atlantoaxial joint is a complex joint between the atlas C1 and the axis C2.
It is composed of 3 synovial joints, 1 median atlantoaxial joint and 2 lateral atlantoaxial joints.
The median atlantoaxial joint is formed between the dens of axis and an osteoligamentous ring of the atlas anteriorly and transverse ligament posteriorly.
Can anyone explain its joint capsule, ligaments?
The atlantoaxial articular capsules are thick and loose, and connect the margins of the lateral masses of the atlas with those of the posterior articular surfaces of the axis.
The ligaments connecting these bones are articular capsules, anterior atlantoaxial ligament, posterior atlantoaxial ligament, transverse ligament of the atlas, alar ligaments, apical ligament, tectorial membrane.
Can you say its innervation and blood supply?
The atlantoaxial joint is innervated by branches of the ventral primary ramus of the second cervical spinal nerve.
The atlantoaxial joint receives arterial blood supply from the anastomosing branches of the deep cervical, occipital and vertebral arteries.
What are its movement?
The atlantoaxial joint is one of the most mobile joints in the spine.
It allows axial rotation, limited flexion, extension, lateral flexion.
We completed this 5-mark question.
5-mark question.
Rectus sheath is the question.
The rectus sheath is a multilayered aponeurosis, a fibrous sheath of dense regular connective tissue that encloses the rectus abdominis and pyramidalis muscles.
The rectus sheath has an anterior and posterior wall.
The walls are composed of a fusion of the aponeuroses of the external abdominal oblique, internal abdominal oblique, and transversus abdominis muscles.
Can you say its function?
The function of the rectus sheath is to protect the muscles and vessels which it encloses.
We completed the 5 marks of this question paper.
So, we leave now and see you all tomorrow. Bye.